I'm Brenda Stanley. I'm one of the NNPs that works.
All right.
So what we thought, what we would do today is just kind of have a structured focus on PICC line and central line care. So how many nurses, we're very informal, so we like to have conversations. We want to hear your experiences, and we want to hear what questions that you have. So what we want to know, what I would like to know, who's a newer NICU nurse and doesn't have a ton of experience with PICCs? Everybody has?
Oh, there's one over there. She wasn't shy. All right. Awesome.
Okay. Well, we hope this helps you, and we hope this helps those that have lots of experience in your NICU setting. Just strengthen your skills and your confidence with caring for a patient with a PICC line. So what we wanted to start with, the way the outline is, we'll talk about placement. For that newer nurse, that was one of the always kind of Dr. Pierce wants me to help her with the PICC line, and to make sure I knew what I needed to get, right? So we're going to go through the equipment that you would go gather, and then Brenda is going to walk us through what she would need from the team member when a PICC line is inserted. Then we're going to talk about assessment. We have some pictures of some x-rays because we know that these are central lines, right? So they're not going to look, if they infiltrate, they're not going to necessarily be at the site. You're going to have to pick up on some different vital signs. What does a chest x-ray look like, and those types of things. And then we're going to have you guys practice. Tell me dressing changes. Do you guys change dressings, or do you have a specific team that does that?
Usually the people that insert the PICC lines.
Okay. So we can not maybe spend a ton of time on that, but talk about when does a dressing need to be changed, okay? And then I brought just our infusion set. Where we live downtown San Antonio, we do sterile tubing changes, and so we can talk about those and kind of answer those questions, okay? And you're Jose, right? Mm-hmm. So we asked Jose to go to the unit and gather everything that you guys would need. So I brought all of the same supplies that are expired and for SIM. So we're not going to open these items, but you want to do show and tell? Tell us what.
Yeah, put you on the spot here.
Here's the copy. I don't have that much experience.
Okay, this is interactive.
He just got the check.
Let's do it.
What do you want me to do?
Okay, so you are going to you have, this is baby Annie. She's one of our not very high fidelity sim dolls. But this is our Annie, and you need to start a PICC line. So you're telling your team member, who is, tell me your name. Astley. So Astley is going to help you. So come on up. This is interactive. We got to
get everybody involved here.
Okay. So she says, okay, I haven't done this in a while, so what do you want me to get? Okay. So this is a 1.9 PICC line tray. That's kind of the standard size. This is that's an Argyle. We have Argon here, and I have another. There's a couple different brands, and so you guys can tell me what your dressings look like. This is a Argon PICC line that's a 1.9, and this is a 1.2. So this brand actually makes really, really tiny. And then we tend to use a brand called Footprints. So there are different brands, and there are different ways to dress them. So that's what we asked to make sure that we were going to make sure that we could dress them the same way of what you're using. Okay. What else do you want? So we've got the tray, and that has a lot of stuff in it.
Of course, the sterile gloves.
Okay.
The iodine.
Okay.
The
Introducer. Okay, you're doing great.
the tader. Gauzes.
Okay, why do we want these gauzes?
To wipe out the iodine.
Okay.
Not because you're messy when you put this. No.
Okay. And
that's just an adhesive remover for the sterile
Okay.
dressing change.
All right. Okay. So, NNP Jose, Brenda's gonna check you off now on this insertion. Okay, so we're gonna come over here, and I hope everybody can see. So Brenda,
Y'all guys can get up and walk around,
Yeah.
take a look if you want.
so the other thing that, since this is sterile, right, we want sterile gowns, right? So we can open that. And since you're gonna help her, you guys will both put these on, okay? There's yours. And she kind of gets spoiled, we'll help her now.
Yeah.
She's like, I'm not used to this.
She's like, I resemble that remark.
And you don't have to put the hats on, but we do want to put a hat and mask on.
Oh, okay. We put the mask on. So we do that first?
Typically I do, yeah.
Yeah.
But I don't think she's gonna make us.
You don't have
right
right now.
Yeah.
We'll assume that you have.
Yeah.
Partial size.
And then your gloves. You want a size 6, Brenda?
I can leave it open.
It's fine.
I have a 7.5 there.
Or that's not yours. This is pretty good.
And then. And I have, don't open that one, 'cause it's not, those are your good stuff.
Yeah, save your stuff.
Yeah, save your stuff. I just wanted to make sure that, I think it's important to know exactly like what you guys are using, that way you have a familiarity with. Astra, you're gonna come over here. And you're gonna have, you would have a hat and mask on as well, like if you were, okay?
Anybody in this area should have one.
Okay. And then you wanna open this?
I can't now.
Well, I can.
Yeah.
So here, over here. So in your tray there, so you're opening that tray, so this is the tray. Oh, look, it has buttons on that. So we're gonna go ahead and you can take those off. And that's all the stuff, the pre-stuff that you would put on first. I'm gonna go ahead and open. That. And then this is where you would drop your catheter and your introducer on, right? So we're gonna use this introducer. That's theirs, this one, okay. This one, okay, so you go ahead and drop that on. And I didn't have an expired catheter, but we're gonna say that we dropped the catheter on. Okay, so come on over here, Jose. And you're gonna open that tray. Maybe you can guide him, Brenda.
So you guys only use betadine here for your prep?
Oh, and the alcohol.
Okay.
Yes.
But you don't
Okay.
use chlorhexidine? No.
So there's betadine in there, but we always have extra. And then when we talk about like just changing tubing and stuff, one of the tricks I like to do, you guys might do it as well, but I like to tear the alcohol before I get sterile and kind of tape it to the bedside. That way it's just there and you don't have to worry about contaminating.
Most important thing. So luckily this kit has got a lot of the extra stuff, so you don't always have to add additional things to it, but every kit is a little bit different. And it doesn't hurt to have additional supplies available in case you need them. One thing we always wanna make sure too, before we start any procedure, is that we have a consent, and that we do a timeout. I'll do that here. Just making
She's like,
sure.
uh-huh.
Everywhere's different, you just never know, so, So we can assume those things have happened. Depending on the size of the baby, if the bedside nurse can prepare the baby so that there's no extra bundles around or anything, so that the baby's just laying flat like this, I find that most helpful. Every provider's a little bit different with what they like. If you have a really active baby, it's really helpful if you could, once your provider has selected the extremity or location that they're gonna use, if you could like swaddle the baby, leaving just that one extremity out and available, that's extremely helpful. And then if your baby is able to have sweeties or pacifier, that's also helpful, to kind of keep them from wiggling during the procedure. Some babies require some sedation, depending on their level of illness, and, if they're intubated, things like that. So that's also a consideration you want to have before you start.
I have a question.
Sure.
Regarding the alcohol, so we wipe with betadine, then alcohol. That's usually the routine, and we would use the swabs like that. But recently the hospital's not providing those swabs anymore. So would it be okay to just, wipe clean with betadine and then with the sterile wipe, the saline wipe?
So typically we use our saline wipe at the end, like when we're done. It is sterile, as long as you retrieve it sterilely. It would be okay. I know we've had to use like alcohol, the little alcohol swab pads, if we don't have the alcohol swab sticks. So it's always an option as long as it's done sterilely. Okay, so we have our baby prepped, we've done our timeout, we have our consent, everybody's good. We have our extremity picked out. This baby already conveniently has it.
Awesome.
You want this arm?
Flip it over?
Yeah.
Sure. So typically what I do is I have my assistant, my nurse assistant, hold up the arm by the elbow so that I can clean from like the elbow down really well. And then I grab some sterile gauze. And again, everybody does things a little bit different, and it's okay. There's no one way to skin a cat. And then after I've got from here down, I will wrap a sterile gauze around the hand so that I can have control and it's still sterile. And then I will paint the rest of the arm, front and back, armpit, all the way up to the shoulder, so that depending on if I start down here and I need to, attempt further up, afterwards I'm cleaning and sterilizing the whole area. Is that what you're used to?
Yes.
Yeah, okay. And then we also have, once all the painting is done and as the arm is drying, I will get either sterile towels. These are actually my favorite, these little drapes with the armhole. Thanks. So I will feed the arm through and then pull this down. And the good thing about this is, especially if you have somewhat of an active baby, you have, once you put this down, you can let go, because wherever the baby moves the arm is sterile. So then I'll usually get rid of my little extra so it's out of the way, and we're ready to get started with the insertion portion. So let's see where our tourniquet is. Sorry, this is not the kit I'm used to using, so.
I have this little catheter if you want.
Okay, yeah, that's fine. And so we have a sterile tourniquet.
See, this is the catheter.
Do you guys use heparinized saline when you insert, or just regular saline? So there's that, and I know she dropped the introducer. So we want to pre-prime our line, and we want to trim it to the appropriate distance. So typically before I even get sterile, I'll examine the baby, figure out which extremity, which vein I want to go for. And I'll also at that time take a measurement for how deep I want it. And pretty much I take it from about 1 centimeter below where I'm gonna insert and measure till about mid chest. And then that usually would give us a central line. So you have our catheter. We always wanna cut it, otherwise you're gonna have all this excess out that you're gonna be playing with for, and worrying about keeping sterile with dressing changes and things like that. So it's just like in wood shop, or you learn to measure twice and cut once. And it's nicely marked for us, a dark line. We have a dark line to start us, and then thin lines till we get the next dark line, that's 5 centimeters, double line is 10, and so on. So, are you okay if I cut this one? Yeah, okay. So, we'll say we're gonna put this one at the 10 centimeter marking, so we just cut.
You do straight across?
Some people do straight, actually what I'm used to is a little guillotine. It comes in the other kit, the footprint kit.
No, okay, yes.
And so it's usually pretty straight.
Here's what this looks like if you want to.
Yeah, this is the little cutter that I'm used to using.
Oh, okay.
So you could put it a little bit on an angle, but square is fine as well.
No.
Yeah, you just want it to be clean. And then we want to prep. Do you guys use I think you do, because I saw them, the little caps. Did you bring
Yes,
caps?
I did.
So we put the caps on and then we flush through the line so that it's primed. We're not putting in a line with it. This is a double lumen cap. Yep.
I do have to.
Oh, sorry.
I came prepared.